I think when you look at how healthcare has built our healthcare ecosystem, really, we are just one small player in the entire,
Yes.
system, right? And then you think, how do I really elevate that? How do we grow? How does the system grow, and how do we grow within that system so it becomes synergistic, right? And I think this is where when you look at the industry in general, you can see many forces at play. So I think for us to be able to, I would say, move forward the right way and at the right time, is about just ensuring that doctors, start to learn and think and be at that forefront.
Well, welcome to the podcast for the American College of Artificial Intelligence and Medicine. Today we have June Lau. Ann and I met June at a recent AI in Medicine conference called AI Med 24 in Orlando. And we initially had some conversations with June that were so spectacular around the intersection of artificial intelligence and medicine that we actually invited her to do our first live podcast today for the college. So thanks for being here today, June. Just a quick background on Dr. Lau. She is from Malaysia, and after her residency there, she practiced as an emergency physician from 2015 to 2020 in Kuala Lumpur, and also was part of the National Crisis and Preparative Response during COVID. Also worked for the National Institutes of Health in Malaysia full-time, and became, in terms of leadership through various organizations such as the Malaysia Medical Association, a chairperson for a Women in Medicine Task Force, a deputy secretary for a national branch for government doctors. So that's just some backstory. She's currently here in Chicago with us, and we're going to talk around her passion for artificial intelligence and applications to medicine and patient care. And I'm going to turn it over to the Executive Vice President of the college, Dr. Ann Slasuraitis, to initiate the questioning. Go ahead.
Okay, well, welcome. I'm so glad that you're here to join us. We're so excited. And then I'll just ask you to maybe give us a brief overview of your background.
So, yeah,
and don't be modest.
I try not to. I try to be as much as I can. So thank you very much for having me here. It's a great pleasure to have met you at the AI Med 24 conference. I guess I'd be honest and say you guys were the highlight of my day, actually. So it was amazing.
We feel the same way.
So just a brief background, because you've done such an excellent job. I don't think I can top that. I'm usually terrible at talking about myself. So June Lau, from Malaysia. I currently serve as the chairperson and founder of the AI in Healthcare and Digital Health Committee. And we've just we just formally started about a week ago, to be exact. And I see a lot of great things ahead. But really very much, predominantly my background is in emergency medicine. I've served at the largest public hospital in Malaysia. That would be the emergency department of Hospital Kuala Lumpur. During my time there, I received 2 Service of Excellence Awards for my contributions. And having spent several years in practice, I decided that it was time to move on into the research aspect of it, because I think in a way, our system is built slightly different from, how it is like in the US. So spent 2 years there. During my time, it was very serendipitous, because it was I entered the National Institutes of Health right before the COVID, when COVID was first discovered, actually. And I was very fortunate to be able to lead and work on several COVID-related researches, publish a couple. And, after that, I was actually called to the Crisis Preparedness and Response Center, which you've accurately captured. Spent about, I would say, 3 months working on national healthcare data collection for COVID patients. Reported directly to the team who sits under the Director General of Health at the time. Again, having always known I wanted a global career in healthcare, I decided the time was almost right for me to transition into something different. And again, I would say a series of great fortune. I had applied to the Thunderbird School of Global Management to pursue a global management degree because, again, I envision being a global leader one day. Still very far from that. And I was awarded the Share Fellowship. So this is actually the school's most prestigious executive mentorship and scholarship program. So that's how I came into here, and that's why you see Malaysia, and then I'm currently in the US, based in Chicago. So during my time there, did a lot of work with consulting basically for health tech and med tech companies just to keep that passion going. I always like to do that. Unfortunately, cannot sit still. Cannot sit.
I'm sure they love you.
Yeah, and I guess at the end of the day, left. I mean, I actually dabbled in entrepreneurship as well. Pitched two ideas in demo day. Won a small grant for one. I like to say all around AI in health. I mean, all involving in integration of AI in healthcare applications, and then decided maybe I should put a pin in that, to further develop my professional identity. So,
Okay, very, very impressive. And we're really happy you're here.
Thank you.
Now, this committee that you started personally, the AI and Healthcare and Digital Health Committee, what is that part of? What organization is that through?
Right.
And more importantly, Ann and I want to know what motivated you to found the committee, to start the committee, to be the founder. So give us like a deep dive into what this committee is.
I'm hearing first, before you answer, that COVID maybe changed your direction
I think
in a very positive way. Is that
it did. I think it changed all of our directions in general.
but
right?
for you in a very positive way?
Yeah, it is. It is like, I like to say as a ER doctor, when you have too much downtime when you do research, for me, that is downtime, right? And then your mind starts to innovate, try to think of new things to do, try to find
When
new
you have
challenges,
downtime.
right? I
Yes,
think that's
I
what
can
all
appreciate
healthcare
that.
professionals do, right? So I think really, to answer your question, the AI in Healthcare and Digital Health Committee is part of the Malaysian Medical Association, which is the largest organization dedicated, largest and oldest organization dedicated to medical professionals advancing, issues that are important to them. And I think it's been around since the 1950s in my country, so very oldest and very first. And really, there were two primary motivations really in this whole. In starting this committee. The first being, really, I think we are at a time where, I've realized that for too long, doctors have always been, I would say, skirting at the fringes of technology. We're always there, but our involvement level is not what I like it to be. I want doctors to be at the forefront of innovative technologies. I want us to be championing those kind of, movements. And when I saw, and I've seen that for a long time, I'm sure you both can appreciate that. And I say, what can I do to start us in the right direction this time? We've seen a lot of gap between end users and developers, so much, and we ourselves doctors are many times at the receiving end, right? And we don't have a say in what gets put in, what gets created. So that's I would say that's one of the first and most important motivation. The second really is just looking at the industry. So again, very serendipitously, I know I'm reusing that word so many times, but in the past year, there's been a lot of investment in Malaysia, specifically in developing AI infrastructure by the Magnificent Seven. So that is, something just for context, it's coined by, I think, the Bank of America. It would say, was it analyst? I gotta, probably edit this out, but I figured that out. But he coined the term Magnificent Seven to describe the large cap seven companies, tech companies. So this is Amazon, Alphabet, Tesla, Nvidia, Microsoft, Meta, right? And I think when you look at this, I would say volume on investments, and that's billions of dollars, right? You realize that this is a signal flare right now. This is a great time for doctors to be involved in those conversations. We are at very much the nascent stages, right? And even, as a matter of fact, just yesterday, Malaysia launched their national AI I would say, development board. So they're going to be involved in regulation of, AI in healthcare and digital technology. So I think all this just again shows how important it is for doctors back home to start engaging in this conversation, start being a part of this movement. So, and that's why,
In Malaysia, is AI being used a lot in the hospital settings?
and I would say that not as much as I would like to. I mean, as I would like, and again, very much at the nascent stages. So while I would say that in the public healthcare side, we are still working on introducing, I would say innovative technologies. We obviously still undergoing that digital transformation process in general. A lot of great work back home, right? But in the private healthcare, obviously it's obviously a couple of steps ahead. We know we have robotic technologies involved as well. So it's just I guess maybe just a slight context. We are a two-tier healthcare system. We have the government-run public healthcare system and supported by a very robust private healthcare system. Does that make sense?
Okay. So are you finding that the doctors are coming on board now? Because I'm still finding some fear with using that, fear of being replaced, fear of the new trainees that they won't be able to think. Are you still seeing that back
I
home?
mean, absolutely. I think because these conversations are still new, right? And I definitely see that kind of fear, about, the lack of critical thinking, when you bring AI in, and the fear of being replaced. But I think actually the root of all this is, bring education really,
Yes.
right? Race, and I always say this, I like to say, raising the baseline. So, right?
Yeah.
If all of us are scared at the same level, that's not going to change anything. That's what I think. So,
Right.
don't want to comment too much.
Now, you're very much high level in AI leadership as we are. What challenges have you faced in this area?
Really, I think personally, I would say just very much just, consolidating all this vast amount of information and trying to figure out where do I go next? Because I think again, as healthcare professionals, we always want to know everything, like the micro level before we can talk macro, right? We are not used to talking about macro without knowing the micro. So I just think that tenuous balance is where I navigate, and having I like to say I've been in multiple spaces, from a clinician, dabble in the entrepreneurship side of it, looked a bit into venture capital as well. So you start to think about things from so many different dimensions, and even now with the addition of regulations, around AI, you sometimes lose focus as to how you want to track through your process of diving through this information and consolidating them into making something, actionable, clear, and, even clear messages, so to speak. I think that is really primarily the most, the biggest challenge in healthcare. And just, yeah. Do that.
What keeps you so motivated?
I think really, no, really, the motivation just comes behind, just wanting to push the healthcare fraternity forward in participating in the next movement of AI. I mean, sometimes, I think when you look at how healthcare is built, our healthcare ecosystem, really, we are just one small player in the entire,
Yes.
system, right? And then you think, how do I really elevate that? How do we grow? How does the system grow, and how do we grow within that system so it becomes synergistic, right? And I think this is where, when you look at the industry in general, you can see many forces at play. So I think for us to be able to, I would say, move forward the right way and at the right time, is about just ensuring that doctors, start to learn and think and be at that forefront. Does that make sense?
That's a great answer. Mel, I'm going to ask you the same question. What keeps you so motivated?
Well, it's really the passion for lifelong learning, to be honest with you. We have entered an era where the knowledge that we need to have moving forward as physicians that we don't have is how to use artificial intelligence for healthcare. We all have seen the power of what it can do. So we want to educate ourselves so that we can help our patients and, more importantly, make the world a better place and improve patient care worldwide. On these podcasts, we are going to be talking with AI leaders all across the globe. And I'm so delighted that June is our first one for Malaysia. I really am.
Yes.
But in other upcoming episodes, I have leaders like June in Australia, in Norway. So we're really going to do a deep dive in how it gets applied in healthcare all across the world, because I truly believe where you, Anne, and June, and myself are going to be difference makers is when we start to use AI to give access to care to patients that otherwise would not be able to get care because they're in an area or a region where there aren't as many doctors as would be needed. And so any thoughts on like access to care in Malaysia? Is this something that AI will be helping with, like provide care to patients that maybe don't have
Because you're
the
interested in
access?
public
Yeah,
health.
absolutely. I mean, I think that's absolutely true and very poignant words indeed. And accessibility is something very true, I think, globally as well, when you talk about access to care. I mean, very simply, like, I think back, when you say this, I think back of the days when I spent in the ER, and you see patients who, and even right before that, when we were training, we do actually rotations in all departments. So I've done all that, and you see patients coming from far away, taking that 3-4 hour bus ride just for one consultation, for you to tell them that, oh no, some of your results are not back, or there's some,
boy.
and things like that happen, and and somehow, things slip through the crack. I'm sure we're all familiar with that. And it's sad, and I think that with AI now, definitely there's great opportunities to overcome all that. But again, I think this speaks to the other part of, we talked about AI readiness, not infrastructure. So I think that's still developing, I think, and we can say that worldwide, in some more, in some countries where, access to even internet is a problem, then how does AI come in, right? But so, yeah, so I think there's that,
Yes.
And, just a random, I mean, I would say, just to digress slightly, on a comment on education, I really love that. And it just reminded me something of, how, I think professionals can really stay motivated is to just dive deep into like AI. It's like, for myself, example, just very briefly, I actually said 6 months ago, I dived into the world of creating my own GPT using the ChatGPT engine. And
Yeah.
it was interesting because I used it for education. Actually, that's what when you said education, that triggered me, because I wanted to see how, when we've practiced for so long, those are experience that, you cannot quantify, but how do you, use that in a GPT and sort of train, medical students, trainees, to go through that same thought process, like how you take history, how you do a physical examination, how
Is
do you
it something that they're using now in the medical schools?
no, this
Okay.
is something I'm dabbling in, and I'm just seeing, how it's going to maybe how I'm going to, integrate it with in larger, I would say, system, in the future, not now. This is just but I just think that.
Are you using it now?
Oh yes,
practicing with it?
I'm still
that's
using
exciting.
it
Yes.
because because it's all about the testing, like learning how to prompt. So when you put yourself in the trenches, you are forced to learn
Yes.
it. So that's what the education. So I am passionate about education as well. I really love the fact that that's your focus. I think that's amazing.
Absolutely.
So
yeah.
what we're trying to, our mission is to educate everyone, the people, the older doctors, the younger ones, and bring everyone together, the computer scientists, the medical educators, the medical learners, the interns, residents, students, and even working with some high school students. And they've all been phenomenal. And we're trying to bring everybody together because for the medical part, doctors may be thinking, well, I don't know how to do that. Or what you're doing, you're training a large language model. People don't really know how
Yes.
to do that. And it's maybe they're fearful of the unknown, or yes, I'd like to do this, but I don't know where to begin. So if we bring the computer scientists and the doctors together, we can all work on these issues together because I think we both need each other. I don't think we can move
absolutely.
forward working in an isolated situation where we don't collaborate with the computer scientists, unless you happen to be blessed to be able to do both like yourself. But many doctors can't do that, and you're fearful of what you don't know or what you think you can't do when you may with the right help.
Exactly, very well
Yes.
put. I would
Yes.
say amazing. Like, I like the way you think about it. It's like just bringing everyone together, and I think this is really the way moving forward,
Yes.
right? No silos, you know. Just
Right. I mean, we can't hide the information in various places.
Exactly.
If we have a common goal and we need to work together.
Yeah.
Now, what excites you the most right now in AI in medicine?
You know, just I think I mean, I guess it would be really easy to say that everything excites me because, again, like you've just accurately, sum it up. It's everyone coming together. It's not just doctors growing and, without the scientists, the data scientists, without even industry players, right? So I think that generally excites me. But I think if I were to pinpoint, I would say precision medicine. I think that's the next frontier. And it's what we're looking at in terms of developing, drug development, in terms of analyzing vast amount of data. Because I guess I see it in a very interesting way that, you know, as doctors, when we practice, we develop those years of practice gives us intuition. So I see AI as honing data as sort of intuition as well. When AI hones it to give you a specific output, for example, that may represent maybe a sort of I would say a distilled version of some kind of large, I would say data intuition, so to speak. So that's how I like to think about it. But it's just one person's thoughts. Yeah.
Okay,
June, I want to
great,
follow back on this
Yeah.
precision medicine, which I love that you mentioned that. So, for people at your level, Ann and I host a virtual lab group, and we have them within most specialties of medicine. But one that we have for precision medicine that is very robust is in cancer oncology, it's Professor Ryan Wynn, was my colleague at the University of Illinois College of Medicine. So he is the lead for our AI and oncology program. And Ryan just published a paper this week with one of the students that works in his lab and his team on precision medicine and using artificial intelligence in oncology. So I'll share that with you.
That's amazing.
So the fact that you're interested in this whole notion of precision medicine, maybe you'll want to be part of our precision medicine lab group or one of the other lab groups.
Don't put her on the spot now.
No worries, absolutely. I think this is where we learn, right? You dive deep, right? And
Right. What skills do you think the healthcare professionals will need for the future?
Right. So interesting question. I mean, well, it's an interesting question, and I think the answer is this: you need the a trifecta of skills, which I describe as AI, the knowledge of AI, the knowledge of business, and your clinical knowledge. I envision a future where all clinical professionals will have these three skills, and probably some would ask why. Why business knowledge, right? But I mean, really, in the world of healthcare, you need to understand the business of healthcare as well, as I will always say. Obviously, primarily, we are driven by creating greater outcomes. I mean, good outcomes for our patients, right? And that's the primary purpose. But there are other factors in play as well that we need to consider, and that's why I call this my trifecta.
I like that.
Yeah, I
Is that your own idea?
Yeah. Just because I play in that space, so I'm thinking maybe perhaps that's what we all of us need to be, and this is where people like yourself, both you and Melvin, is where you hit that kind of charge because you bring together people from all over, right?
Yes.
And the beauty is you bring people from different countries, and that's beautiful.
That's
I say
exciting,
that's
yes.
exciting, that's beautiful, and I would say not really thought about much, right? I mean, everybody's so focused locally, but really the key to unlocking everything, I believe, is global.
What would be your advice to people listening to keep themselves educated in the business part and AI?
Oh, absolutely. I think just I would say just continue reading, continue talking to people. Really, I feel, and personally, this is again very personal, is that I think you really grow by talking to people. Like
Yes.
meeting you, Melvin, again, even talking that I would say we spend about maybe like what 10 minutes maximum talking to each other, but again, it sparked new ideas, and I think this is how you grow, not just by again, I reading is great.
Mhm.
But really putting yourself on the spot. like how, I was, when I went to a conference, I put myself on the spot, learning, talking to people, learning,
Right.
seeing new perspectives, and also
Being hungry for the knowledge.
exactly.
Yes.
And not being afraid to understand, when I say the business side of it, meaning what is, when we talk about ROI, when we talk about, implementing changes, there's always that other aspect of what is the ROI not only to the people we serve, the patients, but what is the ROI to the other side of it, to people that, provide other support for, let's say the kinds of, I would say, applications or, initiatives we develop.
Because we all have a lot of ideas, but if it's not feasible from a business standpoint, it
Exactly.
won't. And it's a really great point that you brought up. That I could see that actually lacking in people's education. There's more out there about AI right now at your fingertips versus the business end. I think. I don't know what you think about that. Go ahead.
So I just want to circle back to connecting my comment about lifelong learning and your comment that as a physician, to really be a leader, we have to have some formalized training in business. And what I want to speak to is you yourself did training through Thunderbird, which is rated I think number one for global business. So congratulations on doing that. As finding time to do that as a physician is amazing.
When in your career did you do that?
I would say I was in the mid part of my career. I know it's quite unconventional, but I would say I was one of those few who took that risk to do a big, I would say a big leap, because I did not only leap into something slightly different business, right? Which again, I think as healthcare professionals, sometimes we have a bit of a hands-off approach, but I also leaped across countries, like just to do it. So some people would say, what are you doing? On the
I'm
other
sure
side.
they said that to you.
But I think, as you were pointing out,
And look where it got you now.
to
And
be
you had the foresight to know that you would need that in the future.
I think I would say physicians' foresight for all of us.
Yeah.
We look ahead, we plan ahead,
Right. Well, to be a true leader in what we are doing, you really have to have some insight into additional education. So, to your point, my first AI certification wasn't in the medical world. My first one that I took was right here in Evanston at Northwestern, where I did my undergrad at the Kellogg School of Management, which is one of the top business schools in the world, just like where you attended. So they just happened to have a really good artificial intelligence in medicine certificate program, and I took it there. But I think it really helps us in leadership and as physicians leaders. So I think I really want to speak to your point that that's part of the triad of doing what we do. And but you, along those lines, what you can speak to AI and the use of, or how we in medical leadership connect the dots with the stakeholders globally. I really want to hear your vision on that, since you have a lot of training in global business and in global medicine. What's your view of global stakeholders and how to connect the dots?
So really, I think in terms of global collaboration, I would say that it's just about connecting the right organizations, whether it's again government, NGOs, associations, and even local businesses. It's just about finding the right hub, I would like to say, where you can bring all of those people together on a level ground to discuss, their interests and their stakes. And if you think about it in a way that, again, as you've already spoke about global, how, global collaboration needs to happen. I would say that, when you come from different places, there are a lot of different culture and societal norms, and that leads into the interaction as well. So when you bring all this, I would say, you collect everyone together, people will start to learn from one another. People will start to change, their approach. People will start to see, hey, maybe getting us from point A to B does not need to be, say, method A. It could be method C or D
Yes.
because the approach is slightly different. So I think it's just about having I think the best way I like to say is having conversations, and again, spark a thought which obviously I'm trying to push forward as an association, as a committee within the association, is to create that global learning hub. And coming from Thunderbird, again, we have this 100 million learners program where we create, I would say, we create very thoughtful e-learning pieces that we actually provide to people globally, and that I think was
Can you give an example of that?
so very interestingly, they did one of these courses they developed was an entrepreneurship, and it's an online e-learning course where people from anywhere as with an internet connection can sign up for and do for absolutely nothing at all, because they wanted to raise the bar of education. They wanted to bring education and knowledge to people globally. And I think similarly in the aspect of creating a global hub, even within Malaysia, even I would say maybe global might be a stretch now. I might need to dial back a bit, maybe regional hub even, right?
Okay.
But
That's coming from Malaysia?
Yes, that's coming from Malaysia, even Southeast Asia. I mean, again, I would like to be very thankful of the great job done by our neighbors, Singapore, with all the AI advancements, strong, support from the Ministry of Health, and in general, strong support. And, I think those kinds of things would really, help in terms of coming together, bringing everything together.
Okay.
Okay.
How do you think we ensure ethical implementation for everyone?
I think the key word for me, please, if you have any other thing, feel free to, like I said, jump in, but inclusivity, having everyone, stakeholders, and when I mean stakeholders, it is doctors, industry players, even patients,
Yes.
come together to talk about the challenges, the norms, even in their practice, in their location, wherever they may be. And when, again, beats back, when you have those kind of conversations, you include everyone. Now that would be the key.
Yes.
Yeah.
Yes. And you know what? I like that you pointed out the patients too, to give them a voice, give them a platform to participate in all of this. I think that piece is missing.
Oh, absolutely. I mean,
Yes.
I really think so too, because, I say this sometimes, as we are all innovators, we think a lot, and, because you sort of try to explore the frontiers, right, of what is possible. And then you start to think about great things, but you forget that the end users sometimes are the patients.
Yes.
You have a great idea, right? But it may not be what they need. It's not their priority. So balancing those kind of priorities. So yeah.
Right.
To your
And then
point.
as we've emphasized, it's not just creating something to create it. You have to think about what problem are you solving? What is the
Absolutely.
problem? What are you solving? Not just to create something to say you did something, but
Exactly.
Now, tell us your hope for the future regarding AI and medicine.
I would like to sum this up very simply: shared prosperity in healthcare. And I think I'll leave it as that, because I think the definition of prosperity can be anything and everything. It's for us to shape that. But I like to end with that. Simple.
And any
Very-
closing thoughts on your end?
Good thoughts. I want to thank you so much for being here. Your energy is motivating, uplifting, and refreshing. And we love to be involved with people with this kind of energy, and we share some of the same thoughts with bringing everyone together. We have to. We can't hide our ideas. We have to share, collaborate. But I'll agree with you that the end result is, can we make mankind better? Can we make the patients' lives better, each other's lives better by doing this? So our motto is AI for good.
AI for good.
Yes.
If you like what you heard at today's podcast, 2 upcoming podcasts that are also global. We have Matilda Dorotic, who's in Norway, and she has recently been at Harvard for over 6 months, and then MIT, and will be implementing artificial intelligence for the nation of Norway. And another one that's global that's coming up soon is Catherine Jones, who's one of the most well-established AI radiologists, who's implementing AI in the country of Australia. So our efforts are definitely global, and we hope that with your help, we can bring the global community together to make healthcare better worldwide. So thanks for coming
Thank
today. It was
you.
really a
Thank
pleasure.
you.
It was a great pleasure too.
Thank you.